Just ensuring that that looks like a full screen to you, Justin.
It looks great. Yep.
Perfect. Thank you.
Sure. So as folks come in, we're just going to give it a moment. So there's a minor tech hiccup. As you may have found with the passcodes coming in here, they should be gone now. So we hope it looks like people are starting to trickle in. So we'll just give it a second and jump into it. Hey, well, welcome everybody. I just wanted to start off briefly. There's a survey link that will appear in the chat. If you fill that out at the end of the day with the sessions that you attended, we'll get you a certificate of attendance if that's important for you. So I want to introduce Corie. She is the director of the content development with DH, a social impact communications agency in Washington. She has a master's degree in teaching and professional experience as an educator, administrator, writer, and editor. In her role at DH, Corie develops content across the sectors and audiences, research and writing on topics like equity, public health, and voter access. As the creative content lead for the Friends for Life campaign, Corie conducted research on how to best communicate about the illicit fentanyl and prevention and led the DH team in designing the messaging that brought this campaign to life. I'll just say personally at the Washington Poison Center, we've worked with DH to distribute their materials. We find them to be great, high quality materials. They reach audiences that we serve with accessible and engaging information. So it's just really nice for me to be able to introduce Corie Bales, and thank you for joining us today, Corie. And go ahead, take it away, please.
Thank you, Justin. I appreciate that so much. And thank you everyone for joining us today for this presentation for the Friends for Life campaign. Although that was a lovely and warm introduction, I want to just share a little bit about myself. So as Justin said, I am the Director of Content Development for DH. We are a social impact communications agency with locations in Spokane and Seattle. Before I worked for DH as a writer and content developer, I have a background in education. So primarily working with middle and high school students in English education. Our work at DH is really designed to make positive impact on the most pressing issues facing Washington State, and that includes issues like illicit fentanyl and overdose deaths. This campaign was created in partnership with the Washington State Healthcare Authority, who funded the campaign. And I wanted to share a little bit about how we work. So as I said, DH is a social impact agency, but what that means is that we ascribe to the principles of social change marketing. And social change marketing aims to influence the attitudes, behaviors, and policies by raising awareness and fostering engagement and mobilizing people for positive change, recognizing that change exists on a spectrum and that we need to work to meet people where they are. In terms of how our social change campaigns usually shape up, they typically include a phase for deep research, both qualitative and quantitative, strategy and creative development, and then implementation, which for us often includes community partnerships and engagement, but can also include media outreach. And finally, reporting on the impacts of each individual campaign. In terms of what we're covering today, we want to share more about the Friends for Life campaign that DH and the Washington State Healthcare Authority made together. Specifically, I am hoping to tell a story of how we unified prevention and harm reduction messaging into a single campaign, beginning with the context and background of the campaign, our messaging approach, and the brand development. I'm also going to take an opportunity to show you some of the toolkit materials, both the materials that we developed for harm reduction and the materials that we developed for prevention, and talk a little bit about our outcomes so far and lessons learned, and then where the campaign is headed from here. In terms of what I'm hoping that you as participants will take away from this, I think one of the main things that I'm hoping for is people to recognize that prevention and harm reduction messages can work together. So often what we've learned and what I've learned in my short time doing this work is that prevention campaigns tend to sort of be over here, and harm reduction campaigns tend to sort of be over here, and they don't normally coexist. But we worked really hard to bring them into one campaign and found that their messages can work together. Also, that audience-informed messaging, meaning talking to people, really matters. And that means talking to people across a range of expertise and lived experience to inform how a campaign sounds and how it looks. And then finally, meeting people where they are and responding to them as respecting them as experts is not just the right thing to do. It's also a powerful communications tool and a way to get buy-in from people as message carriers. So I want to just offer a little bit of background and context about the campaign. The campaign began in 2022. With HCA and DH working together. And when we began the campaign, the problem that existed was that all overdose deaths in Washington, 70% involve fentanyl. And rates were rising fastest among young adults ages 18 to 25. As you all know, illicit fentanyl is driving a radical transformation in our state's drug supply and raising overdose death rates across all counties, ages, and backgrounds. So that's sort of where we began back in 2022. We narrowed down our focus to these campaign goals for our first phase of work. And our first phase of work was really focused on those 18 to 25-year-old adults, young adults, and focused on harm reduction. Our sort of philosophy was that we needed to start with the fire closest to our feet. And since overdose death rates were rising fastest among that population, that's where we wanted to begin the campaign. We learned through the course of research that there was a lack of awareness about illicit fentanyl, and we needed to include some baseline information about fentanyl to make people aware of how the drug market had transformed. The urgent goal of preventing overdose was strengthened with naloxone awareness and our efforts to normalize carrying it across all audiences. We saw these goals as the best way to keep people safe in high-risk settings and begin educating on a topic that we carried through the campaign. So in terms of campaign must-haves, both HCA and DH agreed that the campaign needed to be grounded in quantitative and qualitative research. We believed that and sort of a philosophy at DH in a way that we work is that positive social norming is always going to be more effective than negative scare tactics. But this particular campaign gave a heavy focus on peer networks and support. We wanted the campaign to be scare tactic free and as destigmatizing as possible. Our campaign team, as we developed this campaign, was robust. There were a lot of stakeholders. There were a lot of people who really cared about this issue and wanted to weigh in and ensure that the campaign was a success. So, of course, there were those of us who work at DH, me, my creative co-lead, Hannah Bettino, who is responsible for the amazing look of this campaign and brand, and all of our colleagues who supported the work as well. We had HCA, And so that was the communications side of the house, and then the Division of Behavioral Health and Recovery's prevention and treatment sections. In addition to that, we also engaged the Washington Department of Health, local health jurisdictions, the University of Washington's Addiction, Drug, and Alcohol Institutes, syringe service programs, and also community-based organizations to ensure that the information and resources we offered were consistent and in line with campaigns and information that already existed. So in terms of messaging, I guess before I get into like the specifics of this campaign, I want to say that we have a belief at DH that for any given problem, the people closest to that problem are also the people closest to the solution. And this truth guides our thinking as much as it guides our actions. So in practice, what it means is we actively seek out people with expertise and lived experience who are already doing the work of solving the problem. And we find out what they think, what they want, what they need, and how we can help contribute to the solutions that they have already undertaken. That's true for every campaign that we do, but it was also especially true for Friends for Life. So to reach people for this campaign, we had to take all the research available to us, which included a statewide survey, landscape review of academic literature, one-on-one interviews with subject matter experts, listening sessions with people with lived experiences, and focus groups with the primary audiences that we were hoping to reach. We gathered hundreds, if not thousands, of inputs during the research phase, and when we were done, we worked as a team to distill all that we had heard into key findings that would shape the campaign. So these are not all of the key findings that we synthesized, but they are maybe some of the most important ones, and so I wanted to share them with you. One of the first key findings is that young adults underestimate their own risk of overdose, but can accurately assess risk for others. So whether it's because of their sense of invincibility or other reasons, they tend to think that they themselves are immune to the consequences of using substances, but they are, young adults are particularly concerned about the consequences or effects of use for their friends, and they can accurately assess risk for their friends. That became a really critical point when we were developing sort of the framework for this campaign, and I'll talk about that a bit more. We learned that people who use opioids react differently to outreach messaging than people who do not. So for instance, people who use opioids may already have, first of all, a sense of internalized stigma or shame. And when presented with outreach materials along the lines of, you shouldn't use opioids, opioids are bad for you, something like that. The outreach may be reactive or angry, and they may shut down in the face of that kind of messaging. Whereas people who do not use substances or do not use opioids may be receptive to that kind of messaging. So we knew that we needed to tailor our messaging to actually reach the people we were hoping to reach, which was young adults 18 to 25 who use or may use opioids. We knew that stories of real people positioned in the larger context of the overdose crisis can lower stigma. We understood fundamentally the power of a personal story, but we wanted to ensure that there was not a conception that, or an idea that opioid use was an individual issue, that it was the result of individual choices, but that there was this larger context driving this problem. In terms of working with young people, youth 12 to 17 for prevention, we learned that in-school programs, after-school programs, and community-based programs were likelier to be more effective than online outreach to youth. I want to be clear that we're not saying that social media outreach cannot work with youth. It definitely can. They basically have their phones grafted onto the palm of their hands. What we're saying is that that kind of outreach, social media outreach, really works best when you have young people leading the way, when you have organic user-generated content, when it feels authentic and real. And that requires a heck of a lot of infrastructure building that we didn't feel we were able to do at a sort of communications agency and statewide agency like HCA. And instead, what we heard from the prevention professionals that we spoke with across the state was that they were already presenting curriculum to students in school or at community-based programs or after school programs. So that's the direction that we headed. And then finally, no matter who we spoke with, we heard loud and clear that naloxone is prevention. So what we heard from people, whether we were talking to people who use opioids, people in recovery, friends and family, healthcare providers, educators, was this recurring theme. We heard, I'm scared someone I care about will die because of fentanyl, and I want to know what I can do to keep them safe. We never heard, I'm scared I'm going to die of fentanyl, and I want to know what I can do to keep myself safe. It was only ever focused on the people, their friends, family, people that they cared about. And so in short, our sort of key insight, and this may seem really obvious, but it became really fundamental to the campaign, is that people, all people, regardless of whether they use substances or opioids or not, really care about keeping their friends safe. And this key insight became the basis of our entire campaign. So rather than messages focused on changing any one person's behavior, we were empowering all people with the knowledge and skills to look after their friends. And in this way, everyone plays a vital role in solving the problem of overdose deaths. So we took all of our research, all the key findings, and this key insight, and we returned to our goals for the campaign. We realized that our messaging needed to address 4 main areas to be effective. So first, we needed to close the knowledge gap people had surrounding how much the drug market in Washington had been affected by illicit fentanyl. People needed to better understand the risks of using fentanyl or other substances, and also the risks of encountering fentanyl because it has been added to something else. We also needed to provide people with a positive social norm to associate with this campaign. Again, like this may seem self-evident, but people like to believe positive things about themselves. And so when you can correlate positive social change to a positive personal value, that can be a really powerful way to change people's minds and drive them to act. So what I mean is, being a good friend means carrying naloxone. If you can tie that social change of carrying naloxone to that positive personal value of being a good friend and link that in people's minds, you can encourage them to change their perspectives and to act. We also needed to offer people information and tools that they were telling us they desperately wanted. Again, as part of our research, so much of what we heard was like, we don't want to be scared by a campaign. We're already scared. This is terrifying to us. We really want to know what we need to know and what we need to have in order to make a difference. And finally, we knew that we needed to destigmatize the issue of use, because at the end of the day, emotions like fear and shame are ways that powerfully undermine someone's willingness to act. So I want to show you what this looked like in practice and how we started to merge our harm reduction and prevention messaging. So in terms of our first phase of work, which again was for young adults 18 to 25, we focused on harm reduction. And so our sort of knowledge gap message pillar, our message theme was that illicit fentanyl and other additives are making the drug supply more unpredictable and harmful. In terms of that positive social norm, we developed a messaging theme that friends help keep one another safe. In terms of offering information and tools, we encourage people to learn to recognize and respond to a fentanyl overdose. And in terms of our destigmatizing message, we developed a message that everyone, yes, everyone deserves to be safe. During the second phase of work, which was for youth 12 to 17 and focused on primary prevention, we went back and we scrutinized the original message platform, which looked like this. And to be honest, when we started, we assumed that we were going to be in a position to probably write separate messaging documents for the separate audiences. And what we discovered as we began to look at these messaging themes and decide, are they still relevant? Do they still apply? What we discovered was yes, in fact, they do. And so as we created our messaging for youth and for prevention, what we discovered was really the only thing that needed to change was the information and tools that we offered. And so we developed a theme around take care, don't share. And that was very specific to research that suggested that youth 12 to 17, an overwhelming majority, like 99%, according to the Healthy Youth Survey, don't use pills or opioids intentionally. In order to get high. Instead, they were experiencing opioid overdose because they were encountering it in pills that they believed were legitimate prescription Adderall, Xanax, Percocet, something like that. And so we wanted to offer them information and tools around understanding that unless a prescription pill has been prescribed directly to you from your doctor and you picked it up at the pharmacy, that anything else may potentially have fentanyl in it. In terms of the branding, I just wanted to talk briefly about that. So I think that one thing that we've heard a lot as we've taken this out into the community is that the branding feels really different from a lot of other campaigns related to this topic. And in fact, we've heard, for instance, that like the logo reminds people of like a summer camp emblem or something like that. And I want to tell you all that that was absolutely on purpose and by design. As we again looked at the landscape of all of the existing campaigns related to illicit fentanyl out in the world right now, we found that many of them, even if they didn't explicitly use scare tactics, were still relying on scary imagery. So for instance, their font might be really sharp or jagged. The colors were really dark. They often included imagery of needles or pills as a part of the logo mark. And the sort of like the video assets, the videos that they were created were often in black and white. They featured really really sad music or sort of scary music. And so we were looking to do something really different than that. And when we brought this campaign to our focus groups, we had 3 concepts altogether. This was one of 3 options that we developed. And this one was the most favorably rated when we were talking to youth, young adults or their parents and caregivers, really across the board, this logo, this brand really resonated with people. And so I just wanted to call out a couple of pieces of feedback that we heard through the course of our message testing and focus group testing. We heard everybody is like a neighbor. You don't have to love them, but you should look out for them. We heard that it humanizes the person who's overdosing. It allows people to put themselves in the shoes of someone who could overdose. It destigmatizes the idea of someone who is a drug user. And I think most importantly, the logo has naloxone in it. So I know what I'm supposed to have. And we really, we did that on purpose to socialize the idea of what a nasal spray naloxone canister looks like, but also we found the shape to be really interesting. And for people who don't know what naloxone is, a kind of opening a conversation of like, why do you have a little like rocket ship blasting off from someone's hand in the logo? And gave us an opportunity to talk to folks. I want to just preview some of the toolkit materials that we created through the course of this campaign. So for our harm reduction phase, we spoke with many people, but we spoke with all of the syringe service programs across Washington. And again, considering our belief that the people closest to a problem are closest to a solution, one of the things that we asked folks in the early research phase of the campaign was like, what do you want and need? What materials would be useful to you? What materials do you not have that you need to have that would make a difference? And fundamentally, we made what people told us they needed. So each of our toolkits looks pretty different, and they don't follow sort of like all of the traditional assets that a toolkit might have, because the things that we created were directly linked to the conversations that we had through the development of our creative. So for harm reduction, we created informational posters about how to administer naloxone, what it is, again, sort of combating some of the misinformation about naloxone, that it is dangerous, that it doesn't work for illicit fentanyl, that it's not legal to carry, etc. Some information about fentanyl, again, to close that knowledge gap, and then just a pro-social message that keeping your friends safe means carrying naloxone. We also created wallet cards and tear sheets. One of the things that we heard from syringe service programs was that the people that they served were often unstably housed or unhoused, that they had infrequent access to the internet, and so they were unlikely to be looking at a website. And instead, they would take things that they could put in their wallet, in their back pocket, in their backpack. And so if it was a high quality, sturdy print piece, like a wallet card, that was likely to be something that they could pass from hand to hand and person to person. We also heard from people who did on the street outreach that having something small like this was easy to carry for them. So we developed a wallet card with information about how to recognize an overdose and how to respond using nasal spray naloxone, and a bit of information about the Good Samaritan laws of Washington State. We also created this tear sheet, tearaway flyer sheet, again, on the request and advice of syringe service programs and people doing outreach on the street. We created some pamphlets and social media assets as well, and then also created affinity items. And I will say that one of the most popular things that we've made that people really love are these buttons that say "I carry naloxone." This is just anecdotal, but like as we've been out at community events, pride events, out at different coalition meetings, what we've seen is that people who choose to carry naloxone, first of all, the number's growing, which we are thrilled about, but secondly, they're really proud to be people who carry naloxone. They see that as a way to potentially help a neighbor, save a friend or family, or take care of someone who's experiencing an emergency. And so the "I carry naloxone" buttons and stickers that we've made are really effective affinity items for normalizing the idea that anyone and everyone should have naloxone with them. And it's sort of like you would keep a first aid kit around. We also developed PSA videos that aired during a media buy and that we used across the state. I wanted to show you this. This was made with one of our production partners, Good Bad Habits. And so I'm gonna play this for you now and keep my fingers crossed that the sound comes through.
Every life lost to an opioid overdose is a big deal, especially to the friends, families, and communities left behind. But one small act can make a big difference. Naloxone, or Narcan, can reverse an overdose from opioids, including fentanyl. Almost every time it's used, naloxone saves a life. When they carry and use naloxone, friends save friends, brothers save sisters, parents save their kids. And that's huge. Find naloxone and learn how to use it at wafriendsforlife.org. Every life lost to an
I also want to share some of the prevention materials. So for these prevention materials, these were for youth, 12 to 17. We talked to prevention professionals and coalitions across the state. So we talked to folks that are really looking at this from a statewide sort of 40,000 foot view perspective, but we were also we also had the opportunity to talk to prevention professionals who go into schools on a day in, day out, weekly basis to work with young people and to present curriculum around cannabis, tobacco, and other substance use information. And so what we heard from a lot of the prevention professionals and ESDs that we spoke with across the state was that there was no accepted statewide resource to provide to either parents or students. And so they were in the position of really having to cobble together resources in order to get this information out into the community. And what they told us they wanted more than anything was presentations. And so that's what we made. So we created a localization guide that included a letter to administrators in order to help people who were not already in the school systems go ahead and introduce themselves, the campaign, to principals, vice principals, and other decision makers at the school to hopefully get a meeting set and get a presentation on the books. We also created social media posts to promote presentation events. And we created this adult presentation. The presentation covers basics about opioids and illicit fentanyl, again, to just close that knowledge gap. We also wanted to provide information about youth overdoses in Washington. And I guess I just want to take one minute to thread this needle here. And I'm sure that this is not new information to folks here, but it was a really important thing for us to include as a part of this campaign. So we know that as our PSA said, any life lost to an opioid overdose is a huge deal. But we also know that the vast majority of young people across the state of Washington are not using opioids or pills as a way to get high. And so we had to balance that to say the risks with illicit fentanyl are grave. And also, most young people, despite sort of maybe what you've heard in the media, are not using opioids or illicit fentanyl as a way to get high. And so we had to sort of try to balance that information so that people had an accurate view of how this issue was affecting youth in Washington. Yes, it is serious, and yes, it is a growing problem, but also, you know, taken on the whole, most young people are not using opioids or fentanyl. We covered risk factors, common risk factors, and prevention strategies, including ways to talk to their young people about fentanyl and opioids, and also not sharing prescription, fake or otherwise, pills. And finally, providing information about naloxone. We created this presentation for parents as a dual presentation in English and Spanish. So each of the slides contains English on the left and Spanish on the right, so that it could be provided to communities in whichever language made the most sense. We also developed a suggested script for presenters, just to be able to offer folks a starting point as they were kind of coming up with their presentation. We provided takeaways to be handed out during the presentation and afterwards. So notepads and pens for parents to take notes while they listen to the presentation, and a magnet that just has one of our key messages to help keep each other safe, as a reminder that they can take home with them. We also created brochures that sort of paralleled the presentation and covered, again, information about naloxone, a conversation guides with sort of strategies for how to talk to young people, and then facts about fentanyl. For youth, we also created posters. We differentiated these posters for high school students and middle school students just to be appropriate to sort of their developmental phase that they're in, and also the phase of life that they're in. The posters, we created a set of 3 for both middle school and high school. The topics focused on, again, illicit fentanyl as fake prescription pills, the power of positive peer pressure. I think a lot of times, especially in combination with substance campaigns, we hear a lot about peer pressure as a negative thing, and we really wanted to flip that on its head and think about the ways that friends can be really powerful message carriers to their friends about the risks or harm involved with opioids. And then finally, we heard from a lot of prevention professionals that young people wanted information about how it affected their brain and the sort of science behind it. And so we had one poster on brain development and the effects of illicit fentanyl or opioids on brain development. We also created presentations for students, again, one for middle school and one for high school. They both cover the same basic topics, but they do so at a sort of like at a level that's appropriate for the ages. So they both cover basically what the parent presentation covers, but still the basics about opioids and illicit fentanyl, how it's affecting people their age, what they can do to keep their friends safe, and basics on naloxone. In addition to the presentations, we developed student activities. Again, the activities have been differentiated. The one for middle school really focuses on risk and protective factors, just helping young people understand that there are certain factors that can put them at greater risk of both a negative outcome primarily, but sort of helping them understand that in real life. So asking questions like, what might be if the outcome is a low test score, what might be some of the risk factors that lead to a low test score? Well, staying up too late the night before, or not studying, or even like really experiencing test anxiety. So giving them this thing that's applicable to their real life to think about the fact that outcomes and risk factors are connected, and that there are these things called protective factors that they can do, like getting enough sleep or studying more, coming up with anxiety, like techniques to manage their anxiety that might protect them and keep them from having a negative outcome. For the high school students, we focused on the positive peer pressure that they have when it comes to their friends and social groups. These activities came with facilitator guides, and those are included in our toolkit as well, so that facilitators have a sense of what each activity is meant to accomplish, approximately how much time it's meant to take, and where it fits into the presentation overall. We developed those pieces in mind with a heck of a lot of flexibility, understanding that no matter how well researched, no matter how well developed or designed, that a single presentation and a single activity could never hope to meet the needs of every young person 12 to 17 across Washington State. So one thing that we've been doing in the implementation phase of this campaign is really talking to prevention professionals across the state and explaining to them all of the ways that there's flexibility baked into these materials to really make them feel like their own, like they're useful to them, and equipping them with everything that they need to use those materials, while also explaining some of the things that are the heart and soul of Friends for Life, and some of those non-negotiables. So giving folks sort of guidelines for what they can and can't adapt or amend to meet the needs of their specific audiences. Again, we also developed a parent or prevention focused PSA. This one was not animated. This was live action with real people. And so I want to play that for you as well.
Hey.
If it feels like everything you say to your teenager goes in one ear and out the other, you're not alone. But even when it seems like they aren't listening, they are, especially when it comes to a topic like drugs. Find time in everyday moments to share facts, teach refusal skills, and answer their questions about drugs, including opioids like fentanyl, because your words matter. Get the conversation started today.
In terms of outcomes and lessons learned so far, we went back out to the community and did another survey, statewide survey, about a year into the implementation of this campaign. And so far, the results have been a 37% increase in the knowledge of fentanyl for young adults. Certainly, correlation does not equal causation, but we are extremely heartened by this number. Not saying that our campaign is directly linked to this number, but certainly we are grateful to see such a sharp increase in the knowledge about fentanyl among 18 to 25-year-olds. We've seen a 43% increase in the knowledge of naloxone. From our ads that we have placed on broadcast channels, streaming channels, social media, we've had 65 million impressions from those ads and 172,000 site visits. So far, the toolkit has been downloaded, the various toolkits, whether that's harm reduction or prevention or the parent toolkit, they've been downloaded more than 3,000 times. And through our technical assistance program, we have had at least 21 of 39 Washington counties that we know of share our materials at a local level. In terms of lessons that we've learned, we feel strongly that harm reduction and prevention can exist in the same campaign. And the fact that we were able to retain 3 of 4 messaging themes across those two sort of areas really reinforces this belief for us. And we think that a both and approach creates cohesion among the campaign. We feel like we couldn't have made this campaign without talking to people. We believe that talking to people makes all the difference in the world. And the people that we spoke with fundamentally shaped the way that this campaign came to be. We believe that message carriers really matter. So we were fortunate to have people like Eliseo, who is pictured here, who is a person in recovery, be a spokesperson and participant in this campaign. But we also had message carriers from prevention, student assistant professionals and coalitions and syringe providers and a whole host of people in between be message carriers for this campaign. And we feel that one of the reasons we've had such an effective relationship with our message carriers is because many of them were the people that we talked to at the very beginning. And what they saw as the campaign took shape was that their feedback mattered. And we reflected what they told us in the final outcome of the campaign. And that made them feel like they had a stake in the campaign because they did. And that made them more likely to carry the message forward, to promote the campaign in their spheres of influence. And that was really powerful for Friends for Life. And then finally, we feel like we learned that it's vital to meet audiences where they are. So when we heard, for instance, from syringe service programs that we were never going to reach the people they serve with a website alone, we pivoted to create something different in the wallet cards and in the tearaway flyers. So those were some of the lessons that we've taken away from the campaign so far. In terms of where we're going next, we are expanding outreach to youth and young adults in higher risk settings and from populations that the data shows are more likely to use opioids and therefore potentially experience opioid overdose. This includes youth and young adults who are Black, Latin American, Latino or Latinx, but particularly those who have migratory farming family members, LGBTQ plus communities, but especially trans people, youth and young adults who are involved in the justice system, youth and young adults who are unstably housed or unhoused, and those who live in foster homes, group homes, or transitional homes. We are working with community-based organizations to reach these specific priority audiences. Again, like I said at the very top of the presentation, there are so many wonderful, hardworking, and dedicated people already committed to solving this problem. And what we're trying to do is connect with them and provide them with the communication materials they need to help the people they serve. And finally, because we know that sort of prevention and harm reduction and treatment all exist on the same spectrum, we'll be incorporating treatment and recovery messaging into the Friends for Life campaign so that the campaign really is not just prevention or just harm reduction or just treatment and recovery, but runs the full gambit, which is really a reflection, I think, of how people's real lives work. And so we're hoping that the campaign meets people's needs no matter where they find themselves. This is a QR code that will take you to the website. The website is listed there up top. If you have any questions, I'm more than happy to answer them here today, but I also wanted to offer my email address. If you have any interest in receiving technical assistance to localize any of the materials that we have, for instance, to add your logo, your organization's logo to any of our materials to distribute locally, we'd be more than happy to assist you with that. And with that, I will pause and turn the mic back over to Justin to answer any questions.
Wonderful. Thank you so much. That was excellent. We do have a couple questions that came in. So first one comes from Naomi. Do you know if any of these materials are being used in juvenile detention exit programs? I know my local county juvenile and family court has just started becoming interested in talking about opioids among youth. Not too soon, not too late, hopefully either, but glad to hear that.
Naomi, thank you so much for that question. I think that that's exactly the type of program that we're seeking to find entry points into for this current phase of work that we're developing now. And so I would say to that end, if you have any connections, if you would like to connect, we would be very interested in making sure that our materials get into settings where youth and young adults involved with the justice system are, to be able to reach them with this message. But to my knowledge, thus far, we have not.
Great. And then we had a question about how do we order supplies? I think that's been answered, and we'll also type the answer into uh, the the Q&A box too, so you have it in writing there. Another question came in from an anonymous attendee. Were any of the tribes involved in creating the messaging, flyers, or toolkits?
Yeah, that's another really great question. So we have a separate campaign that was very much created in partnership with and advice from tribes across Washington. That website is called For Native Lives, and the campaign is called For Our Lives. It takes a very similar approach to Friends for Life, but it uses the input and wisdom from the tribes to inform the creative and some of the messaging. But it also runs the gambit from sort of prevention, harm reduction, all the way through to treatment and recovery. It's a really excellent campaign, and I would strongly encourage folks to take a look at it.
Indeed, I live in West Central Spokane, and we have a billboard from the For Our Lives campaign just down the street from where I live, and I drive by it all the time, and it's really cool to see. Question from David. Do you messengers do any direct trainings with community service providers or youth?
Yeah, so we David, great question. We basically will present to anyone who will have us. We absolutely have a goal of helping this campaign go as far and wide as it possibly can. And so to that end, we've done several presentations with community service providers, with coalitions, with prevention professionals, and not so much directly with youth. That, to my knowledge, we have not done, but absolutely happy to present this material, present the campaign, talk about ways to use the materials in practice. We actually have a community-based organization in Concrete, Washington, that's going to be speaking to another group, or possibly already did speak, it might have been today, but about the ways that they are localizing the campaign for their community, including using some of the PSAs at local movie theaters, going to community, like local farmers markets and community events. And so we definitely are happy to provide those trainings and to talk through ways that this campaign can be used at a community level.
Great, thank you. Another question from an anonymous attendee. Do you have an opinion on self-harm reduction kits at school libraries, or schools or libraries, excuse me?
I don't personally have like an opinion on, well, I guess I might want to make sure I understand the question. I know that many schools are now requiring, I know to this point, schools of a certain size require, by harm reduction, meaning naloxone, they require naloxone in their first aid and at their nurses' offices. But I believe with a recent passage of some legislation that that all schools are going to be required to have naloxone on the premises, which you know, I guess I would say my general opinion of that is that that's a good thing. Young people, youth have unfortunately died of opioid overdoses on campus. And the presence of naloxone very much could have saved their lives. That's obviously a tragic loss for the individual and their family, but it's traumatic for the students, the faculty, and the whole community. And I think that if having naloxone on campus prevents a tragedy like that, then personally, if you're asking my personal opinion, I'm all for that.
Yeah, we've been excited to see that pass at the Poison Center, and we actually do have Megan just put the link in the chat. Next week we have a panel discussion on naloxone in schools, and you can register for that. It's next Wednesday. I think it's the first one of the day, but you might want to check the schedule. So that's all the Q&A from the group. I had a couple questions though as well. So I was wondering, do you find that there's any groups that this type of messaging didn't appeal to? I noticed like the 21 and 39 counties. I know personally, like with the Poison Center, you know, we're always kind of changing our message depending on who the audience is, or not necessarily our message, but what we focus on to appeal to diverse groups of people. Have you run into any obstacles with that, with this type of material?
So we certainly have had a few what I would characterize as fringe groups write on their own websites, blogs about this campaign. I think what they fundamentally get wrong is that they positioned our harm reduction campaign as something that was going out to youth 12 to 17, when in fact it was for young adults 18 to 25. So they sort of misrepresented the age range. And of course, aren't bought into the idea that naloxone is life-saving and in fact does not enable drug use in any way, shape, or form, and that knowing about naloxone does not make young people more likely to use opioids or fentanyl, that those two things are not linked. So we did have some of that initially, although it was really isolated and again quite fringe. I would say that some of the student assistant professionals that I spoke with, some of the ESDs that we spoke with and prevention professionals said that that they were expecting to be met with resistance by the school's administrators. And this seemed to be, some of it seemed to be about the makeup of the county, whether it was urban, suburban, rural. There was a bit more reluctance in rural counties, but also it seemed to also be where people had maybe not been immediately affected. So what we heard from a lot of places is that if a young person in their community had experienced an overdose, the schools wanted this information in the school setting to help equip young people. But where they hadn't experienced the issue directly, they experienced the student assistant professionals and prevention professionals said that they were anticipating a little bit more reluctance.
Thank you. Yeah, I do a lot of naloxone, opioids, and stigma trainings too. And that moral hazard argument of naloxone encouraging risky behavior comes up sometimes. And I've looked and looked and looked to try to find any basis for it. And there's none. There's actually multiple studies that say that's not the case, that there's no evidence for this. So if anyone has questions about it, I encourage you to do a little research because it's really interesting what you'll find. Yeah, I saw you had Spanish and English. Do you offer any other languages, or has there been any consideration for other languages as well?
Yeah, we do. And thank you for asking. I think that's a great question to sort of conclude on. So we have translated our prevention and harm reduction materials into all of the major languages spoken across Washington: Arabic, Somali, Russian, Ukrainian, Spanish, Vietnamese, I think are the primary ones, but we are continuing with the funding that we receive to expand that. So the toolkit's available in those languages that I mentioned. The website is available in English and in Spanish.
Excellent. Thank you so much for your time today. Thank you for sharing your expertise. Folks, I really encourage you to check out the Washington Friends for Life website. It's in our chat right now. It's just wafriendsforlife.com. It's outstanding. You can find toolkits on there as well to download and contact them too. Corie, we really appreciate your time today. Thank you so much. Folks, we also do have one more panel today from 3:15 to 4:30. I'm sorry, it's not a panel, it's a presentation from 3:15 to 4:30 p.m. It's adolescent over-the-counter overdoses. So we hope to see you all there. Thank you again, Corie, and thank you for the important work you're doing in these wonderful resources that you allow us to share in the community. We appreciate you.
Thank you,
Bye,
Justin,
everybody.
and thank you, everyone.